Welcome back to continue our discussion talking about temperament in children, part two. Joining me again, Dr. Robert Hudson, clinical professor at the University of Oklahoma School of Community Medicine, and you're in pediatrics.
Right, I don't do general pediatrics now. I limit the practice to helping parents understand their children and help manage their children and help teach their children the skills they don't have. And most of my parents call me Dr. Bob, so.
Okay, well then maybe I'll switch to Dr. Bob. Now, in our first segment, we talked about the different temperament styles and described what they were and sort of examples of what you might see or how to work with them. Let's go a little deeper with that.
Okay.
In a school setting, let me ask this question because this is a big one. If you have children that are in pre-K, for instance, and teachers may feel that they're a little bit more, they're more shy, they don't really participate that much in class, they really don't volunteer answers, maybe their maturity level is not quite ready for them to move on to kindergarten. Is that a good thing when we look at children that way and we want to retain them in that grade level because they're not as participative in class, they don't ask as many questions, they seem to be a little bit more reserved?
Cautious.
Right. Tell me about that.
I think that kindergarten teachers are very good at assessing a child. One of the things that has happened over the past 30 or 40 years is that the range of normal has shrunk from here down to here and shifted down. So the expectations on the child sometimes are greater, and when they're outside a smaller range of normal, they consider it abnormal when it really isn't abnormal. The child that is having any kind of problem, it should be addressed. To address it by saying, let's hold this child back, really is counterproductive. In the 80s, it started saying, well, we're going to assure success, and so we're going to hold them back.
Right.
Well, the studies that have been done since then says there is more harm done in holding a child back than sending a child forward.
Really?
And to give them an extra year to mature, most of what they're talking about is a temperament trait that's not going to change. So the end result is you've taken a year of that child's life waiting for them to mature, when if they're shy, they're always going to be shy. Can they learn to get up in front of 5,000 people and give a talk? Sure. But it's not going to be normal for them. They're going to have to overcome it and learn how to do it. But holding them back is not going to really address the problem. It just delays addressing the problem.
So looking at that too then, because that does tend to be the tendency, we want to hold them back for another year of maturity and things such as that. How does the child maybe view that? Let's look at it from that perspective. What would the child think?
That's an interesting question because they interviewed seniors in high school that had been held back, and over 75% of the children, of the adolescents said that they felt like their parents didn't believe in them and the teacher didn't believe in them, that they could do the job. Well, you really don't want a child starting off an educational process having people not believe that they can do it.
Right.
And so I think that that was one of the studies that got everyone thinking, whoa, well maybe this isn't a good thing. So it really has become less common. It used to be very common in the late 80s and the early 90s, and now most of the school districts don't really, I know the Tulsa Public Schools don't, I know Jenks and Union don't, I know that the larger school districts really, they want to address the problem rather than hold the child back, and that's the proper approach.
Now, if you're finding this because of the maturity issues, what are some of the options that the teachers have? Then, like you said, the child can be taught to overcome some things, but if they're generally more shy and a little bit more reserved, I know when I go into a new environment, and I'm sure that's my temperament style, and I've come to understand and appreciate that, I don't just jump right in.
Right.
And I mentioned that on our first show. I tend to survey the area, see what's what, and it may take me a little bit before I really begin to engage.
Well, the temperament trait is called approach withdrawal. I call it cautious curious. But the cautious child, or the child that tends to withdraw from whatever is brand new, the way you manage that is to give them plenty of time to warm up to where it's not new. As soon as it's not new, then it's okay, and there's not that much reservation about it. It's sort of like introducing peas. I don't know if I said this on the other show. If you've got an infant and they're very cautious, and so you introduce peas for the very first time, they're going to reject it because it's new.
Okay.
And so most parents remove the peas and then introduce them 6 weeks later. It's brand new again. So the way you address that problem is you put peas on their plate every day for a week. The first day they look at it, the next day they touch it, the next day they smell it, the next day they lick it, and then the next day they taste it, and then it's not new. So then they either like peas or not because they're peas, not because it's new.
Okay, interesting. And you know, in saying that, you can begin to see the temperament styles as young as infancy.
Oh, yes.
Like I said, we're talking about older children, you know, school age or that, but even young infants, you can begin to see what their temperament styles are probably going to develop into.
Well, and that's very interesting because there's a new study that just came from Toronto looking at children that were difficult during the first year of life, and it increases depression and anxiety in the parents and later in those children. And a lot of times that first year of life, the parents have no place to turn. If it's their first child, she sees all these other people not having trouble, you know,
Right.
and then she's having trouble. There must be something wrong with mom, or there must be something wrong with mom and dad, and they start feeling guilty, and then they get depressed as they internalize that. And so we really need to let them know children are different, and they're different from the start. And I can do a temperament assessment at 4 months on children. In fact, we're going to do some research on young children to screen them first if the screen is positive, to do the assessment, and then to draw the parents in and do some training. And this is what I do in my private practice, but do it in a setting of early education.
You know, and that's good because really what you're saying too that I'm picking up on is we need to sort of expand that normal again instead of keeping it so restrictive.
Right.
Because whenever people or children or even adults are not within what we say is normal, then we want to categorize as being something wrong. But there's a
Exactly.
different range of normal. Now let me ask you this question. Children who tend to have the high energy that we talked about, and you mentioned before
Right.
that might be labeled attention deficit disorder or
Right.
attention hyperactivity deficit disorders, you know, all
Right.
those combinations. Should we look differently at those children and this medication issue? Because many of them end up being medicated.
Right. I think that you can have the diagnosis and not necessarily have to be put on medicine. I think that we need to look at how the child is functioning. If the child is having trouble, then I think that concentrating and they're falling behind in their studies and they're not learning, then maybe we should consider the meds. If they're not having that kind of problem, then maybe we can delay it until they do, because a lot of these kids go through elementary school okay. They hit junior high school, they got much more complex math, they've got longer reading assignments, and so then it begins to pile up on them, and then maybe they need the help. But if you also add that they have a learning problem on top of that, then maybe the meds are necessary. So I think that it needs to be looked at in a functional way, not just that we can put a label on this child and then fix it.
Okay, good information, because sometimes we don't break it up and look specifically at what really is happening.
And there are things that we teach the parent to do to help the persistence or help the distractibility or help the activity level too.
Okay, all right. We're going to take another quick break and come back and pick up our discussion. Please stay with us. We'll be right back.